This information comes from, I was preparing the endocrine system module for the pet health coaching program, and we're about halfway through, and it's just been a ball. But for years, it's really been bothering me about what is going on with all of our pets that are spayed and neutered, and why have all these horrible diseases cranked up in the last 15, almost 20 years now. And so I did some more research and came up with this. So investigators at Oregon State came up with a possible mechanism, and it's the role of luteinizing hormone. And you hear luteinizing hormone and think the thing that helps to get the eggs ready to be fertilized and all of that good stuff. And what they've found is that the LH levels are 20 to 30 times normal what intact dogs levels would be. And these are all the tissues that luteinizing hormone can interact with. So the thyroid, the adrenal glands, the GI tract, the cruciate ligaments, the lymphocytes, the hips, all of the cancers that we've been fighting. And so this is just like, okay, wow, okay, here's an answer. Luteinizing hormones receptors are also found throughout the lower urinary tract in dogs. So this is what's theorized to be causing hormone responsive urinary incontinence, because there's tons and tons of LH receptors. And the other problem is that the LH receptors also sit near the TSH receptors for the thyroid gland, the thyroid stimulating hormone gland receptors. And so it could be interfering with the function of those receptors. And then dogs without their gonads have more lymphocytes and T cells in specific. And these are the ones that end up developing into lymphoma. And the other thing that they found, Dr. Michelle Kutzler is the one that's leading this research, is that as the LH hormone level increases, the number of LH receptors increase in the target tissues. And unfortunately, this is where they are. And so adrenal cortex, blood vessels in the brain, in the GI tract, the ligaments, the cartilage, the bone, the lymphoid tissues, the skin, the white blood cells. And then we end up with all these syndromes, which is essentially everything I have been fighting for the last 20 years, especially this one, fear and behavior issues. The number of dogs that have anxiety or some version of it is just off the chart. And then what we're looking at, the other thing that's interesting is that prostate adenocarcinoma is actually, the chances of developing this is actually increased if you are a neutered male dog. Now, granted, thankfully, the incidence is pretty low, but evidently being neutered actually selects for this type of prostatic cancer. But all these horrible cancers, transitional cell carcinoma in the bladder, osteosarcoma, hemangiosarcoma, lymphosarcoma, and mast cell tumors, which is just at exponential levels. And
Dr. Ruth?
Yes.
Is there any data on, I know you're not really supposed to neuter or spay till a bit older. Spirit, I don't know why they did it, but he was actually neutered at 3 months.
And
I know that's exceptionally young.
That's not uncommon because, and this is the thing, we've become so aggressive with spaying and neutering that now the standard of care is 6 months of age. In veterinary offices, most rescue groups or shelters will not let an animal out with its gonads. And so being neutered or spayed at 12 weeks of age has become extremely common. And in Great Britain, things are a wee bit different, which I'll circle back to in a minute. But the data I can refer you back to is from the Old Gray Muzzle Tour. And if you've heard me speak about this before, a guy, and I apologize, I cannot bring his name to mind at the moment, but he works for a longevity institute for humans, and he uses Rottweilers as his model of study because they just get horrible stuff. And getting to 8 for a Rottweiler now is just astonishing. He kept somehow meeting people with Rottweilers that were 13, and he just didn't understand it. And what he finally realized was that none of them were spayed or neutered. And so what he found, and so he embarked on the Old Gray Muzzle tour, and he visited the homes of these people with these very ancient Rottweilers, and made friends with them and followed the dogs. And what he found was that they died with cancer, but not of cancer. And they essentially died of natural causes. What his recommendation was to, if you have to spay and neuter, to wait till at least 5 years of age.
Ow.
Because that's essentially the time that's about 45, 50. So that's about the time of menopause and andropause. But I think this will explain part of why humans are also having a lot of autoimmune disease later in life when we go through menopause and andropause. So all of these things are just horrible to have. And hair cycle arrest is when we will spay or neuter a dog and the hair never grows back from the sites where it was shaved. And it's because the endocrine system just got shut down. And so the least of the body's worries then is keeping the skin and hair healthy. It just was, when I started reading this literature, it was just heartbreaking, but it explains a lot. So the interesting thing is, in us, menopause and andropause cause similar issues. So there are a ton of women I've talked to that it's just once they go through menopause, just all hell breaks loose. And what happens is the adrenal glands become responsible for producing physiologic levels of estrogen, progesterone, and testosterone. And golly, we weren't really supposed to live to be 60, 70, and 80. The median lifespan for us was 32 up to about 1900. And then around 1950, that went up to about 46. And after that, it's risen to about 73 in the last few years, although in the United States, I think it was 78 for women, but that's been declining over the last 3 or 4 years, even before COVID. And why is that? Part of it is the standard American diet and the sedentariness and things of that nature. But part of it is hormones and also the interplay with all the other garbage that's out there in the environment. So this has caused a really massive interest in hormone replacement therapy in people. And I will tell you, I had testosterone implants. I think the first one was in January, and that was a huge game changer. Essentially, I think about life like this. When we're young and we're at the top of the funnel, we have a wider margin for error. And as we age, it gets more narrow and narrow. And what that did was widen my margin for error out considerably. And so the edges of how much exercise I could do, what I could eat without getting into trouble got a little further out from the center. So this is fascinating. And the mechanism that's proposed here is that it downregulates gonadotropin releasing hormone, which I'll explain about a little bit more about in a second. What that means for pets is, if we can prevent the overproduction of gonadotropin releasing hormone, which is what causes luteinizing hormone production, then we can start to interrupt this cycle. And indeed, there's a veterinarian named Dr. David Bieber who has been exploring testosterone injections for dogs, elderly dogs, both male and female, and he's seeing really remarkable results. So what happens is, when you give testosterone, or if you give estrogen, if you have a female dog that has urinary incontinence secondary to being spayed, and you give estrogen, the problem goes away. And it's because we are suppressing that GnRH production. I think there's a sort of a diagram in here in a moment that explains a bit more. And if not, I'll pull it up from the folder. But in South America, they are actually developing vaccines against gonadotropin releasing hormone that will suppress luteinizing hormone. And for an intact male or female dog, this prevents them from being able to make sufficient estrogen and testosterone to be able to reproduce. And for right now, there don't appear to be any side effects. And because they retain the testes or the ovaries, then they can produce slightly more than what's barely necessary to maintain physiology of estrogen, progesterone, and testosterone, and not force the adrenal glands to do all the work for all of their lives. And in the UK, I just sometimes I wonder about the marketing people in veterinary medicine. So this is a product in the UK that is used to sterilize male dogs. And the tagline just kills me. There is more than one way to crack a nut.
Oh.
It's just, oh, it's like Cinelife, the worst named product ever. But basically, this is a hormone implant, much like the testosterone pellets that I had. And essentially, you can have either a 6-month implant, which is, I think, 4.5 milligrams, or a 9 milligram implant, which will last for a year. Now, in the United States, unfortunately, this is not available for sterilization. It is available for ferrets to prevent something called adrenocortical disease or hyperestrogenism. And again, the idea is that you shut off the GnRH production and it stops them from going into season. So the problem with ferrets is if they don't breed, they keep cycling like cats and they end up with some pretty nasty problems. So it is available for ferrets in the US. When I asked Dr. Kutzler if anybody was using it off-label for dogs and cats, unfortunately, nobody is to neuter them. And also, she is not aware of anybody that is using it as a treatment for the effects of having been spayed and neutered. She was hoping to get a grant from the American Kennel Club to use this implant to treat lymphoma. But that unfortunately fell through, which is crazy. But I just find that fascinating that if the theory is that if you take away the GnRH production and prevent the luteinizing hormone production, then you prevent the lymphoma cells from being able to survive and thrive and replicate. Now, what is available in the United States from Virbac is this very nifty food for spayed pets, which is lower in carbohydrates. And so if you look at this little graphic of the macronutrients of the diet, it's 36% protein, 36% fat, and 28% carbs, which is exactly the macronutrient ratio of the crock-pot diet. However, it's just crap. It's Beneful with a very expensive label and less corn in it. So that just, I had a really good laugh at this. It's really, you guys, come on. But this is the thing that is so just maddening is that this is used in the UK to neuter dogs and probably keep them healthier. But because Virbac has decided to sell this pet food, it's not available in the US to spay and neuter pets. So there you go. Let me pull up this little graphic too. So this makes a wee bit more sense. And maybe I screwed up and didn't get it in there. Ah, here it is. Nope, that's endocrine disruptors. Apologies. Yeah, I think I screwed up and didn't get it in there, which is why it was. But basically, no, here it is. So the hypothalamus, and I apologize for the size of this, but it is what it is. The hypothalamus is what kind of kicks off the production of any of the endocrine glands. So in this case, we're looking at gonadotropin releasing hormone. The hypothalamus produces this, goes down to the anterior pituitary gland, and then it produces luteinizing hormone, which goes down to the gonads, which then produce estrogen, progesterone, testosterone. And then when there are sufficient levels of those hormones in the system, then it tells both the hypothalamus and the anterior pituitary to knock things off and stop producing so much. In the spayed and neutered pet, there's no negative feedback. So until there's a negative feedback, until there is these things saying, hey, knock it off, guys, the hypothalamus continues to produce gonadotropin releasing hormone. And then the anterior pituitary produces luteinizing hormone in spades because it's not being told to stop it. And because this GnRH production stays high, then those receptors are constantly occupied, telling the anterior pituitary to keep it up, keep making LH. Does that make sense? So part of what happens in us as we go through menopause and andropause is, and Mary Jo is shaking her head because she's heard this for the 5th time. And she's like, oh my God, not again. But part of what happens is for us is that our gonads are no longer able to make these hormones in sufficient quantities. So my theory is that we've not been spayed or neutered. And we know for women that if you have both ovaries removed before the age of 64, your life expectancy has dropped by 4 years, all cause mortality. And so I think what happens is this similar mechanism is going on. There's no feedback to tell the hypothalamus to knock it off. There's no feedback to tell the anterior pituitary gland to knock it off. And so then we end up in a situation where all of these receptors, we're getting LH production way high. All of these receptors are developing in response to the amount of luteinizing hormone that's present. And here comes the cancer, the cognitive decline, the GI issues, the bone and joint issues, all of that list of things that so many of us are dealing with, including autoimmune disease, because the immune system is not regulating itself properly. So that's what I know. And then back to wrapping this up, essentially you all are doing what I know does help as far as providing some raw materials. Simplex M and Simplex F, and these are human products, have some levels of estrogen and testosterone. So I think that is helpful. And they supply the ovary and the testes with raw materials to help producing some levels of hormone. And then they also contain adrenal gland as well as pituitary and thyroid, so that these glands don't get overstressed. And the other thing is supporting liver function in our pets, because the liver is responsible for clearing the excess hormone. And so if the liver is unable to keep up with the amount of crap that's in circulation, then that's another reason why the hormone levels stay so high. So we would add in supplements that will improve phase 2 detoxification. So that would be things like milk thistle on a regular basis, quercetin, which incidentally, Kathy, that steps in every place turmeric steps in as far as reducing inflammation. So that's my mainstay as far as inflammation control. And then feed lots of brassica veggies. And brassicas contain phytonutrients that help the liver function better. And in people, there is a supplement called DIM50 that is one of the phytonutrients in the brassicas that helps work. And The other thing, if you've got the time and space and aptitude for it, is sprouting broccoli seeds. So that way you can get just ginormous amount of sulforaphanes, which carry all of the phytonutrients that would help the liver function improve.
May I
So
interrupt you for a moment on
please
that?
do. Mhm.
Okay, there is a company that I think is selling this, I don't know how you pronounce it, the broccoli sprouts in a powder form. Do you think that would have the same effect, or you're better off with just nuts?
I think it's like everything in life. If you can do it fresh, that's the best. If you can't, powdered would be the way to go.
Okay.
Yeah. But for convenience sake, that's awesome.
Okay.
And actually, on the human side, there's a woman named Dr. Rhonda Patrick that has done an inordinate amount of research into this stuff. And so I think she talked about specific doses on many of her different podcasts. But if you go to her site, she talked about this product, but the dosages that she's taking currently for herself, she said that would be really quite costly with this supplement. But Kathy, I think some is better than none. And so if that's the way it's going to happen, then that's what I would do.
Okay. All right. It's so interesting what you're saying, because I tuned in for Daisy and Dottie, but all of a sudden, after 20 years of suffering these skin problems that came out of nowhere, that was diagnosed as skin lupus and blah, 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 and everything else, it's menopause. It happened at the exact same time. After 22 years, it just, the first time I ever connected those dots only through this conversation, this talk you're giving.
Well, and this is I mean, it helped me understand too, part of why I had such a hard time recovering from my relapses. Part of it was the mold, I know, but I entered menopause basically at the same time. And it was like, I was walking on a tight line, and then I really hit the dirt, and it took me some time to get back. So I connected with a group of human healthcare practitioners, but we're all dealing with pretty similar issues. Testosterone is a pretty easy sell to most doctors. There's a lot of different forms, as far as there's troches that are oral, there's creams. For me, the oral one and the creams never worked. The implants work beautifully, so I'm going to try a repository injection as well. But I can feel it when the levels were starting to drop. My brain started to shut back down. I became more sensitive to everything. It's just, oh, for God's sake. But I'm hoping to bring on one or two of the women that I met that do hormone balancing for other women. But it is just astonishing what this ends up impacting in our lives. And I think it's really important, because most conventional doctors never connect the dots. Or they'll say, oh yeah, that's associated with menopause, but then you're left hanging. And here you are 20 some years later, suffering all that time, and nobody's been able to help you. And that's absurd. So hopefully this makes sense, and it will set you on a path to change things around a bit.
Oh, absolutely. Thank you.
With pleasure.
Thank you.
So here we go. So feeding the crock-pot diet, you just cannot beat fresh. So that's really what's important. The high fiber helps to help the GI microbiome stay healthy. And it keeps the other guys back under control, the bad guys. And then the next step would be supporting gut function. So again, fiber to help improve detoxification. Healthy microbiome helps to improve detoxification as well. So a lot of the reason that the liver gets hammered so bad is that our microbiomes are out of whack. And that's really where the most, say 80% of the detoxification should be happening. But because our guts are whacked, both ours and our pets, it doesn't happen very effectively. And so the liver is really not happy. And then reducing inflammation, and then also assists in clearing excess hormones. And that's it. But I really wanted to share this with you because it was like, wow, this finally makes some sense about what's going on for both us and our pets.